Hello dear students, today we will talk about facial bones. Last time we were talking about cranial bones, and we said we have 8 cranial bones and 14 facial bones. Facial bones are very small, and we will start about from frontal side. From frontal side we can see which structures. We can see orbit, we can see nasal cavity, and we can see our jaw. And here let's start from superior side. We said superior one, frontal will include the cranial parts, the cranial bones, and go to a little bit down, and this one it's the nasal bones. We have 2 paired nasal bones. They are paired. There also include 2 facial bones. And which bones are included? From anterior side we can see the maxilla bones are here, zygomatic bones are here, and mandible bone are here. And in middle side we can find, for example, vomer are also bone, and we said inferior nasal conchae are also include 2 facial bones, but we can't see normally. And we must know about lacrimal bones. Also we can see here are also include 2 facial bones, and palatine bones are include 2 facial bones, and hyoid bones also. And let's come to nasal bones. Let's start from smallest one. It's a nasal bones. It's also paired, we said, and let's see here this is a paired. One nasal bone and second nasal bone. It's joining with frontal bone and maxilla bone. And it's also paired of the nasal bones meet at the middle and form part of the bridge of the nose and raise to the support tissue of the nose. Nose consists of cartilage, and we know that the nose have cartilage because it's elastic parts, and the base of the nose consists of nasal bone. And we came maxilla bone. Where is the maxilla bone? Here we have maxilla bone. And let's identify here what do our maxilla bone are forming. It's a superior jaw bone, and here it's also a wall of nasal cavity and wall of orbit, and it's joining with zygomatic bone are here. And let's talk about maxilla bone. And we saw this maxilla bone also paired, and this a paired maxilla unit together to form one upper jaw bone, and articulate with every bone of the face except the mandible or lower jaw bone. We say that, for example, sphenoid bone in cranial bones, they are joining with all bones in cranial cavity, and this bone is a maxilla bone which is articulate with all facial bones and form this but except this mandible bone, because mandible bone is not joining this maxilla bone. And it forms part of the floor of orbits. We saw before it forms part of the orbit and part of the lateral walls of the nasal cavity and most part of hard palate. And also maxilla forms hard palate. We said it's the biggest part of hard palate, and it's a bony portion formed by the palatine process of maxilla and horizontal plate of the palatine bones that forms floor roof of the mouth. And this horizontal palate of maxilla bones and palatine bones are divided are nasal cavity and oral cavity. Each maxilla contains a large maxilla sinus that empties into the nasal cavity. We know that we are talking about frontal bones which are opening into the nasal cavity. Frontal bone has cavity. We will call like sinus, frontal sinus. It's opening into nasal cavity. Ethmoid sinuses are opening into nasal cavity, and sphenoid, which there include cranial bones. And from facial bones, we have maxilla bone, which have sinus also, and it's also it will be opening in nasal cavity. And the alveolar process of the maxilla is an arch of containing the alveolar socket for the maxilla upper teeth. This one Here it's joining with upper teeth. And the palatine process of horizontal projection of the maxilla that forms the anterior 3 quadrants of the hard palatine. The union and diffusion of maxillary bones normally is completed before birth. And infraorbital foramen, it's the opening into the maxilla below the orbit. Infraorbital means below the orbit, and it will be called like infraorbital foramen. An inferior orbit feature located between the greater wing of sphenoid bone and maxilla. Here we can see the maxilla. This is the maxilla bones. We say this maxilla bones is period bones, and it have processes. It have frontal process which goes and from superior side joining with frontal bone, and based on this we will call like this frontal processes. And from anterior side it's joining with nasal bones, and from lateral side we can identify zygomatic processes are here, and it have also plates, for example orbital plate and the horizontal plate are here. Orbital plate are not so horizontal, but it forms the lower wall of orbits, parts of the lower wall of orbits. And we are talking about alveolar processes are here from lower side alveolar processes, and between the two are maxilla bones we have suture also, and it will be called intermaxillary suture because between two maxillary bones, and we will call it intermaxillary suture. And let's identify here infraorbital foramen, this one. It's very important. And after maxillary bones, we have same period bone. It's a zygomatic bone. It's called like cheek bones because it's under cheeks and forms the prominence of the cheeks and part of lateral wall and floor of each orbit, and articulate with the maxilla and frontal sphenoid and temporal bones. Let's show from zygomatic bone. Where is the zygomatic bone? Here is the zygomatic bone. With which bone is joining? Let's start from upper side. It's joining with frontal bone, it's joining with sphenoid bone, and it forms the lower lateral wall of orbit, and it's also joining with maxilla bone are here. And from a lateral side, it's joining with a temporal bone. It have temporal process of maxilla bone which is joining with temporal bone. And next one is the lacrimal bones. Lacrimal bones are also paired. We have two lacrimal bones. When we are talking, for example, about 14 facial bones, it's very seems very impossible to remember them, but they are all paired, and because of this, we can make it a little bit more simpler to remember. And we have paired lacrimal bones. Lacrimal bones we also can't see, but we must know that in the medial wall of the orbits we can find lacrimal bones, and it's the smallest bone of the face and thin also, and resembles the fingernail in size and shape, and posterior of lateral of nasal bones, and forms a part medial wall of each orbit, and contain the lacrimal fossa, a ventricular tunnel formed within the maxilla that house of lacrimal sac. And when we will talk about the eyes, we will talk about lacrimal sac, lacrimal duct, and this lacrimal bone connect our orbits with nasal cavity also. And lacrimal fossa gathers tears of passage them into the nasal cavity. For example, it's connecting between orbits and nasal cavity. When we are crying, we can feel a fluid in nasal cavity. Why? Because we have connection between them. And the other paired organs, bone, it's a paired palatine bones, are from posterior side of hard palate, which are form hard palate with horizontal plate of the maxilla bone, and it's L-shaped bone, and forms the posterior portion of the hard palate, I said before, and part of the floor and lateral wall of nasal cavity, and smallest portion of floor of the orbit. And the horizontal palate of the palatine bones forms the posterior portion of hard palate, which separates the nasal cavity and oral cavity. And let's see this our L-shaped bones. Here we can see this one is the L-shaped bone and second bone are here. They are two period bones. And let's see here. Let's have firstly why we call like palatine bones, because the main part is here. Its nasal crests are here when it's joining with each other, and this one is a horizontal process. This one is a pyramidal process. Are from two lateral side, and upper side we can identify two processes. Which we say it's the smallest part will form orbital wall, and it have orbital process are here. And from inner side it's joining the sphenoid bone, and it have sphenoidal process. And how many processes it have? Just here we can see three processes have here. And inferior nasal conches are also period bone, and inferior is the medial nasal conches of the ethmoid bone. Scroll-like bones that form a part of inferior lateral wall of nasal cavity and projects into the nasal cavity. The inferior nasal conches is separate bones. They are not part of ethmoid bone. When we are talking about cranial bones, we say the ethmoid bone forms two conches or conches, and these two conches are formed by the ethmoid bone. It's the superior and medial, but inferior we say the inferior nasal conches are separate bones, and this we have from two sides of nasal cavity. We have two inferior conches that are also pairs, and all three pairs of nasal conches helps screen and filter of air before the pass into the lungs. How it's helped to screen and filter? Because it has ciliate cells, for example, in nasal cavity, not just bone, and it's make our nasal cavity a little bit bigger. Please, for example, this inferior nasal conches are staying like this, and the portion of nasal conches are making our area bigger and help to filter our air. And only superior nasal conches involved in the sense of smell. And the last is not last, it's before last, and this one is unperiod bones. We came to unperiod bones. We are talking just about period bones, and unperiod one is a vomer. Where is the vomer? Vomer is here. As the blue one is not vomer, blue one is cartilage. When we are touching our nose, it's elastic. It can change shape just when we are touching. Okay, and the back side of the vomer of the nasal cartilage we have vomer. And triangular bone, you can see the triangular shaped bone, and located in the floor of the nasal cavity, because in the upper side also we have sagittal plate of the ethmoid bone, and it's articulated with them, and articulate superiorly with the perpendicular plate of the ethmoid bone, this one, or sagittal plate, and the inferior with the both maxilla and palatine bones. Where is the maxilla bones? Maxilla bones are here, and palatine bones are here, L-shaped, and it's going to lateral sides, L-shaped bones. And it's a part of nasal septum, and portions that divide into the nasal cavity into the right and left sides. And we came to mandible bone. Mandible bone is unpaired, and lower jaw bone, largest, strongest facial bone, and mobile skull bone. Other skull bones are not immovable, and this one is mandible bone is include to movable. Which other bone is movable in skull? We will come to it also, and consists of curved horizontal portion, and we will call it this part, it's a body, and two perpendicular portion, the rami, and the angle of mandible is the area where each ramus meets meets by body. I want to show the parts. Okay, where is the body? This one is the mandible one. And where is the body? Here we have body, and here we have rams. And between rams and body we have angle. This one we will call like angle. And here we have processes, and we will talk about this process. The alveolar process in arch contains the alveolar socket of mandibular lower teeth. We know about it. And the mental foramen is located below the mandibular second premolar tooth. The mandibular foramen is the medial surface of each rams, and the mandibular foramen beginning in the mandibular canal, which run oblique in the rams and anteriorly to the body, deep to the roof of the teeth. And inferior alveolar nerves and blood vessels, which are distributed by the mandibular teeth, pass through this canal. Where's this canal? This one. This one mandibular foramen. It's opening here. Nerves and arteries are going to our teeth here. And which structures we can see? Here we can see two processes, condyle processes. Here's the biggest one. In the end of condyle process, we have articulation surface, which covered by cartilage, and it will be mandibular condyles. And here is the second coronoid process, and between them we have mandibular notch. Here we have mandibular notch. And we are talking about body, angle, and rams. This one is the alveolar processes, also the alveolar processes which are contained our teeth or tooth. And here from anterior side we have another foramen, it's the mental foramen, and mental tubercle are from anterior side. And also hyoid bone is unpaired, and it's a single bone or unpaired, and unique bone, it's not articulated with any other bones, and suspended from the styloid process on the temporal bones is ligament and muscles, and located in the anterior neck between the mandible and larynx. Supports the tongue, provides attachment site for the some tongue and muscles of tongue and muscles of the neck and pharynx. And hyoid bone consists of horizontal body and period protection called the lesser horns and the greater horns. Muscles and ligaments attach this period protection. And this one is our hyoid bone. And we can see the middle parts like a mandible bone, they have body parts, and here it's the same like mandible bones, they are but not joining with other bones, and it have just a muscle which attached by styloid process. Styloid process, when we are talking about temporal bone, we say we have styloid process and mastoid process from back side, and you can see the styloid process. Stylohyoid muscle are starting from styloid process going to hyoid bone, and we will call like stylohyoid muscles. And here in mastoid process we have another muscle, and we will talk about when we will talk about muscles. And we said it's a hyoid bone between mandible bone and larynx. This one is the larynx, and it staying like this. It also have cornus. These parts which have body and cornus, biggest cornus or greater cornua and lesser cornua, also from this side. And what is the function? We say it is a function to attach our muscles of tongue. The muscles of tongue coming and attach here. Muscles of larynx, muscles of neck are coming and attached here. The importance of hyoid bone, it helps to support the tongue and serves an attachment point of several muscles that help to elevate the larynx during swallowing and speech. The hyoid bone is unique in that it's an only one bone of the body which does not articulate with the other bone we have said before, and instead it's suspended above the larynx. They are ensured by ligaments of styloid process of temporal bones of the skull. When the process is also assist in locating a vocation cord, then intubating a patient, we must know when we are intubating, we must know when we are going to larynx, and we must know that here we have hyoid bones. And the difference of adult skull and skull of fetus or newborn. And here we are talking about sutures. How many sutures we are talking when we are talking about cranial bones? Are both, for example, coronal sutures between frontal bone and parietal bones, and there was immovable. Firstly, in adults they are immovable, but in fetus they are movable. Why? Because they must go through the birth canal, and it must change the size of our head of skull, and hold skull bone together. These sutures hold skull bones together, and all skull bones are formed joining with sutures, except our mandible bone, because it's one bone which is movable, and it have 5 prominent sutures. And these sutures are, for example, coronal sutures are between frontal bone and parietal bones are here, and this one is also coronal suture. And in fetus, this coronal suture have in middle parts anterior fontanelles are here. Why anterior fontanelles is 4 angle shaped? Because we have here other suture between frontal squamal part of frontal bones, and we are continuing of this fontanelle. It's a sagittal suture. And from back side we can find the lumboid suture are here between parietal bones and occipital bones, and here is the lambdoid shaped, and here between them in fetus we can find the posterior or small fontanelles are from back side. And squamous sutures are from lateral side. Which bone have squamous part? Temporal bone have squamous part, and here we have squamous suture here. And metapic suture are between nasal bones and frontal bones. Nasal bones and frontal bones. They are also after birth coming and fused with each other. And here we have another fontanelles, for example, mastoid fontanelles and sphenoid fontanelles. Sphenoid fontanelles in level of sphenoid bone, mastoid fontanelles in upper part of mastoid process of temporal bone. And we have said about sinuses, about paranasal sinus. We said about sinus of each bones, for example, frontal bone, ethmoid bone, sphenoid bone, and maxilla bone. And this sinus will open into the nasal cavity, and we will call like paranasal sinuses. Cavity within the central cranial and facial bone and connect with the nasal cavity. All sinuses are opening into the nasal cavity and lined with the mucous membrane, and contains sphenoid, ethmoid, maxillary sinus. Frontal, sphenoid, ethmoid. 4 sinuses we must know: frontal, sphenoid, ethmoid, maxillary. And the disease of these sinuses we will collect sinusitis. And fontanelles. What's the function of fontanelles? Soft spot areas of anastoid membrane chimes, and soon after birth it gradually becomes sutures, and intramembranous ossification. It will be ossificate like this, and it's fontanelles, anterior fontanelles or frontal fontanelles, posterior fontanelles. Anterior lateral fontanelles is sphenoid fontanelles, and posterior lateral fontanelles is mastoid fontanelles. And let's talk about each fontanelle. For example, let's say like this. The biggest one is anterior fontanelles, and anterior fontanelles is diamond shaped. Its end is the largest one and closed at 18 and 40 till to 24 months after birth. And second, from large of the size, it's a posterior fontanelle, are also smaller than anterior. We said you can see, and it have triangular shape. Here, if it's diamond shaped, it's triangular shaped, and closed in second month after birth. And what about sphenoid fontanelles? Sphenoid fontanelles is small, irregular shaped. And other mastoid fontanelles also small. They are very small. It's very important, these two fontanelles, anterior and posterior. And this one small sphenoid fontanelle is closed in third month after birth, but first one we will close it mastoid fontanelle. Why? Because it forms base of the cranium here, and it's irregular shape also, and it's closed in from first month till the second month of the after birth. And muscles, we will next time talk about muscles. And in our unit, in our syllabus, we have some parts of our topics. For example, abnormalities of skull bones. There are, for example, cyclope, when somebody or a patient have one eye, but they are dying because this newborns have many problems with organs, and for example, cyclope, hyperthyroidism, hypothyroidism. It will be part of your homework, and which abnormalities you can find, for example. Okay, and thank you for watching, and bye bye.